money. I'm going to present this new multifocal IOL, also defined as asymmetric rotation geometry multifocal IOL. It's built by Mplus, a German company based in Berlin. Why are they called asymmetric? Because this lens is different from the diffractive IOLs because it hasn't the rings, but overall it has a sector-shaped near vision segment that you can see here. So when you rotate the IOL, the focus for near rotates with the IOL and doesn't remain in the same position. So if we rotate the lens, you can see that the rotation also the focus. Instead, if we rotate diffractive normal IOL, the focus remains in the same position. If we look at the surfaces, we can see that there are two refractive surfaces that with rays that meet at point O, and both focal points are on the same optical axis. If we look at the IOL from the point of view of the topographer, we can see that the light distribution is modified by the lower sector-shaped near vision segment. So what happens? That the rays passing through this zone are refracted away from the optical axis. The lens is also pupil independent, but another important thing is that there is no jump between near and far vision. So we have some pros that we have only 180 degrees overlapping imaging, so we can say that there is almost 50% reduction of halos and glare. There is a minimal light loss, 8% only. This data comes from the company, but has been demonstrated by Professor Hoffert. So we can have a low reduction of contrast sensitivity. There is shorter or no neural rotation time, improved image quality, and since there are no rings, there is less diffraction to be rim. On the other side, we have to orientate the IOL in the back. In order to orientate the best the IOL, you can see that on the optic part there are two marks, and this button. This is a model called C-loop. On the plate haptic model, there are two inferior buttons and one that has to be in the upper position on the right. The C-loop model has a 12 millimeter length, the other one is 11. There are some differences. The recommended minimum incision size is 2.2 for the first one and 1.8 for the second one. The material is called HydroSmart. It is a hydrophilic material with a surface hydrophobic. These are my personalized values. The company declares 118.5 more or less for the C-loop model. It is 118.1 for the plate haptic model. The surface is convex, 6 millimeters. The posterior surface is spherical. There is no correction of the spherical aberration, and there is a 360 degree real square edge. Why real? Because Manfred tests demonstrated that the company uses this particular technique, the subminimal lathing, so they do not polish it at the end of the process of building, and this means that the square edge is real acute. So you will see that the TCO rating will be very low. My clinical experience at early month of this year were about 49 eyes, mean 64, male Mplus 13, male Mplus 23, male 11, female 25. We included in our study only cataract patients with any other pathology. Astigmatism less than 1 diopter, uneventful surgery, and 2.2 temporal incision. These are the results. As you can see, since this These are eyes in very good condition of health. They have a very good vision for network vision for far, a good vision for near, and a quite good vision for intermediate distance. I started this slide from a paper published by Professor Claudio, where he compared the monofocal IOL and this multifocal IOL. As you can see that the optical performances are quite good. I was a little skeptical when I saw this slide published by Professor Halford, because the blue line indicates the contrast sensitivity of the Mplus compared to the competitors. But a few weeks ago I received my new instrument by Tapcan for measuring the contrast sensitivity, and I have to say that the level of contrast sensitivity of the Mplus is really very high. Post-operative refraction. It is important to note that the autorefractor isn't able to measure the